Welcome to another in our series of one-chart video tutorials. Today, we will cover the proper process for initiating the Fall Prevention and Management EBP Adult IPOC, when this should be done, along with addressing the subsequent sub-IPOC for post-fall care, which starts in a planned state and is used in the event of a patient fall. To begin, we will have signed into OneChart, established a relationship with our patient, and open the chart. Next, we'll navigate to the patient's order profile and open the drop-down for any suggested IPOCs that may have been generated. Remember, suggested IPOCs are system-generated by rules that execute based on information that has been recorded for your patient. In this case, our patient had a Hendricks score greater than 5, and therefore the IPOC Fall Prevention and Management EBP IPOC was suggested. It is important to point out that this IPOC, although suggested, must be initiated or accepted as it is indicated as an EBP IPOC. It is a general rule of thumb to always accept and initiate any evidence-based practice IPOC as indicated by the EBP and/or evidence-based nursing IPOC as indicated by the EBN. Please note, if your patient falls and does not have the Fall Prevention and Management EBP Adult IPOC initiated, it must be initiated or manually ordered and initiated to proceed forward with post-fall documentation. Follow standard ordering processes for ordering nursing IPOCs. Continue by either right mouse clicking on the IPOC and selecting Initiate and navigate to the High Risk Fall Management option, or you can click on Accept. Additionally, you can also select and click on Accept in the upper left-hand portion of the IPOC detail window. I will select the Accept option. Immediately notice after doing this that the new sub-IPOC post-fall care appears in a planned state. This is created for documentation should your patient suffer a fall. Continue by selecting the Orders for Signature button, followed by clicking on Sign. Accept the yes for the pop-up, and then complete the process by clicking on the refresh. The Fall Prevention and Management EBP Adult IPOC now displays with the high-risk fall management component initiated and the post-fall care component in a planned state for future use if needed. Should your patient suffer a fall, you must now initiate the post-fall care sub-IPOC, which is in a planned state. You would have opened the patient's chart, navigated to the patient's order profile, and then located the post-fall care sub-IPOC and select it. The IPOC immediately opens in detail to the right, and you immediately notice that there's an order that requires your attention. This order is the consult to pharmacy. If your patient's fall is related to medication or you feel it may be due to a recent change in medication, modify this order accordingly, identifying the reason for the consult. We will deselect this at this time. From here, select the Initiate button in the lower right-hand corner of the screen. Review the Orders for Signature and select the Orders for Signature button. Complete by clicking the Sign button. Refresh the screen. And you'll now notice that the post-fall care sub-IPOC is in an initiated state. If we now navigate to the Activities and Intervention screen, you'll notice on the list is a new task for post-fall assessment. Additionally, if we navigate to Care Compass, refresh the screen, pull up our patient's task list, scroll through the list, we now have a post-fall assessment task on our task list, and if I click on Document, it immediately launches us to the appropriate section of the flowsheet to record our post-fall documentation. Once on the flowsheet, make notice of the yellow required fields and complete. When prompted to complete the date time found required field, this will set up follow-up tasks for 24 and 48 hours post-fall, which will bring you to the post-fall injury evaluation form. This completes the tutorial for properly processing the Fall Prevention and Management IPOC and subsequent sub-IPOC for post-fall care.